Georgina Lewis and Beck Rogers. So if they can approach the screen, and we'll tell you a little bit about them. So Georgina is a clinical manager at the Victoria's Vaccine Safety Service and is interested in kind of the paediatric, so had a background in paediatric nursing and works particularly also as an immuniser in the community, so she's getting on the ground information about that. And the second speaker, Beck Rogers, is a pharmacist who's very passionate about the evolving role of pharmacy in vaccination. And the two of them are going to talk about clinic and pharmacy strategies to vaccinate more Australians. So can we please welcome both Georgina and Beck.
Heading in the right direction. Hi everybody. Thanks for having me today. So today I'll be presenting on how community pharmacies are playing a critical role in vaccinating more Australians, and I'll share some strategies that are proving effective across the sector. We'll begin by looking at the history and growth of vaccination services in community pharmacy and why this model has become such a valuable part of Australia's immunisation landscape. From there, we'll walk through the key enablers of success, such as that word accessibility, workforce preparation, patient engagement and digital communication. And I'll also highlight some real-world strategies being used across pharmacies to increase vaccination uptake, including proactive identification of patients, tailored service delivery, and effective promotion through digital platforms and in-store messaging. And finally, we'll explore how expanding into areas like the NIP and travel health is further strengthening the role of pharmacy in public health. So the history. Pharmacist-led vaccination in Australia began relatively recently, with Queensland pioneering this space in 2014 by allowing pharmacists to vaccinate against influenza. So this was really a turning point in broadening access to immunisation and laid the groundwork for other states and jurisdictions to follow. The COVID-19 pandemic significantly accelerated the role of pharmacists as vaccinators, with a really urgent need to immunise large populations really quickly and safely. Community pharmacies stepped up, delivering millions of COVID vaccines and demonstrating their capacity to be frontline immunisation providers. While legislation still varies between states and territories, we're seeing an expansion of pharmacist vaccination scope. South Australia, I'm really proud to say, is really leading the way in this space, with pharmacists now able to administer any vaccine as long as they do so in line with the Australian Immunisation Handbook. And why it works? Well, one of the biggest strengths of community pharmacy is their accessibility. Pharmacies are conveniently located in urban, regional and remote areas, making them one of the most widely distributed healthcare providers in the country. Pharmacists also are highly trusted by the public and deeply embedded in their local communities. Patients are used to seeing their pharmacists regularly, they really value their clinical advice, and that makes pharmacies an ideal setting for opportunistic and scheduled vaccinations. So what do we need to be able to provide vaccinations in community pharmacy? To successfully deliver vaccination services, pharmacies must first establish the right infrastructure. This begins with having a private consultation room that meets privacy and safety standards, allowing patients to feel comfortable and ensuring clinical care is delivered in a professional setting. Next, comprehensive policies and procedures must be in place. These guide every aspect of the vaccination process, from cold chain management and consent to managing adverse events and post-vaccination observation. Clear, well-documented procedures support quality and consistency across our teams. Workforce upskilling is also essential. So pharmacists have to complete accredited training programs in immunisation, CPR and anaphylaxis management. And in some pharmacies, pharmacy assistants are also trained to support the administrative side of vaccination services. And that helps to improve workflow efficiencies. So clarifying roles and responsibilities within the team is critical. from the vaccinating pharmacist to the staff member who might be facilitating patient flow and documentation. Everyone needs to understand their role and their part in the service. That helps to reduce errors and ensures smooth, coordinated care. And finally, leveraging booking and recording platforms is a key enabler. Online systems allow patients to book appointments at their convenience, while integrating recording tools ensure accurate documentation and seamless reporting to the Australian Immunisation Register. So moving on to talk about our first strategy to improve the uptake of vaccination rates through community pharmacy. We've talked a lot about accessibility, and I'll add the word convenience. So community pharmacies are one of the most accessible healthcare destinations for Australians. There are over 6,000 community pharmacies nationwide, and collectively they handle more than 443 million patient visits annually. On average, each Australian visits a community pharmacy 18 times a year, regardless of whether they live in metropolitan, rural or remote areas. When it comes to proximity, the accessibility is remarkable. In capital cities, 97% of residents are within 2.5 kilometres of a pharmacy. And even in regional and remote Australia, 74% of population is within that same range. Additionally, over 2,000 pharmacies offer after-hours services, some even 24 hours a day. They are open during weekends, evenings and public holidays. So this extended availability ensures that vaccinations can be accessed beyond traditional clinic hours. So as we've talked about, pharmacies also embrace online booking platforms, meaning that patients can schedule their vaccination appointments when it suits them. And as well as that, where possible, pharmacies will accept walk-in appointments as well. So that offers flexibility to those who need it most. We're also seeing pharmacists expand beyond the four walls of the pharmacy setting, providing vaccination services in corporate workplaces, aged care facilities and schools. So this outreach further improves vaccine coverage and brings healthcare closer to where the people are. Strategy 2, proactive patient engagement. So that's key really to increasing vaccination uptake in community pharmacy. One of the most effective strategies is the identification of eligible patients during dispensing. So every time a prescription is dispensed, it's an opportunity to discuss vaccination when that prescription is collected. For instance, recommending an influenza vaccination to asthmatic patients when dispensing their regular inhalers, or perhaps herpes zoster to older adults. These opportunistic conversations at the counter or in a consultation room really prompt patients to take action that they may not have considered before, because the recommendation is coming from their trusted and respected health professional. It's also really important to understand your local demographic and tailor your services accordingly. For example, in areas with a high proportion of young families, a really good idea is to offer family-friendly vaccination clinics. So extended hours or group appointments, they can help remove barriers and boost participation. Community pharmacies are uniquely placed to adapt their services to reflect the needs of their population. And finally, we can use other appointment types as well, such as medication reviews, health checks, or minor ailment consultations as a chance to identify recommended vaccines. For instance, if you're in the consult room talking to someone about their cardiovascular risk, it's a great time to bring up what vaccinations they might need, like influenza or pneumococcal vaccination. And our software enables us to check their immunisation history through integration with the AIR to really streamline that process. These proactive strategies really help to build trust, they raise awareness and make vaccination a routine part of the patient's healthcare journey. And of course, we can't go past digital marketing and service offering. So a really strong digital and marketing strategy is essential to drive awareness and uptake of vaccination services in community pharmacy. Automated SMS reminders are one of the most effective tools for prompting action. These can be used to remind patients about upcoming appointments, boosters that might be due, or seasonal campaigns like influenza. They're timely, targeted, and really easy for patients to act on. Electronic direct mail-outs is another way to reach your existing patient base. So these can provide more detailed information about available vaccines, eligibility criteria, and also how to book. They're particularly useful for engaging with patients who maybe are not visiting your pharmacy as frequently as others. Social media, of course, can be used for good and for evil. Things like Facebook and Instagram are really good for broader community engagement. They allow you to share timely updates, highlight new services, and showcase the accessibility and professionalism of your pharmacy team. And we can't underestimate the power of in-store signage as well. Posters, window decals, and digital screens really help reinforce the message for walk-in customers, sparking questions and conversations about vaccination that might not otherwise have happened. Lastly, as we expand our service offerings, it's really important to promote new programs, like we've talked about today, the National Immunisation Program vaccines, and travel health services. It not only broadens the scope of pharmacy-based vaccination, but also creates new touch points for engaging with patients and improving public health outcomes. So when digital tools, in-store messaging, and service innovation work together, pharmacies can deliver highly visible, convenient, and trusted vaccination services. So my key message today is that community pharmacy is a vital partner in Australia's immunisation strategy. Pharmacies are everywhere, from remote towns to city centres, and they are highly trusted by their communities. This positions them uniquely to deliver vaccination services efficiently and equitably. With appropriate training, infrastructure and support, pharmacists have shown that they can provide safe, effective and timely vaccinations, especially in moments of public health urgency, like during the COVID-19 pandemic. We've seen how proactive patient engagement, tailored service offerings and digital communication tools can make a real difference in vaccination rates. And as new programs like the NIP Vaccinations in Pharmacy program and travel health services expand, pharmacies are really well positioned to meet that public health need. The opportunity now is to keep that momentum going, to expand this service offering across the nation so that we have national consistency, to refine our strategies and continue advocating for greater scope and support across all states and territories of the country. I'll hand over now to Georgina.
Okay, thanks very much, Beck. So following on from Beck, I'm obviously not a pharmacist, so I'm a nurse background, so immunisation nurse, and currently manager of the Vaccine Safety Service in Victoria. So we receive adverse events following immunisation, including vaccine administration error. And as time's gone by, we're actually starting to see more pharmacists involved in this reporting, be as the provider, the reporter, the dispenser, so all things pharmacy. So hopefully I can fill some of the gaps today from what Beck's talked to you about and the strategies for better uptake of vaccines in the pharmacy setting. So I think we've heard also that there's not a lot of pharmacists in the audience here face to face. There might be a few more online, but that's not to say that you can't share this information and just have a better overview of what's actually provided in that pharmacy setting. Noting that pharmacists are a growing, healthcare provider in the delivery of these vaccines. So hopefully some of these tips will help you out in your day-to-day settings as well. So just looking at the NIP, looking at some RSV prevention product indications and recommendations. We won't go on about that too much. I think we've heard a bit about that today though. Maternal vaccination, looking a bit at travel, co-administration technique, the importance of that, and EV reporting, including error and prevention, and just some of those practicalities there. So if we start off with the pharmacist-led vaccination, I think Beck's given a good overview in terms of the scope of practice, which has been expanding since 2014, and currently the National Immunisation Program vaccinations in pharmacy, which supports the pharmacies in providing those NIP vaccines as well. So legislation does vary by state, so it's really important to understand your scope within jurisdiction when you are delivering those vaccines. So not all pharmacists will be doing it, but if you have signed up for that program, you need to understand what you can initiate and administer and what's involved in that, and that really does vary by jurisdiction, as I mentioned, which is one of the challenges moving forward as well. So some states are piloting expanded roles for community pharmacists to administer a wider range of vaccines, including some travel vaccines. So Victoria, for example, is involved in that. It's really important, as we mentioned, for vaccinations to be recorded on the AIR, the Australian Immunisation Register, as part of helping to track immunisation coverage moving forward as well. So more recently, we've obviously got the RSV program as well, so that's just highlighting it's a changing landscape, and it's really important to be abreast of what's going on, new programs, what your involvement with that can be, educating the public and your consumers that are coming in, and that's across the lifespan. So to do that properly, I think you really need to ensure that you understand the National Immunisation Program, which is ever-changing, as we know. So pharmacists are involved in various aspects of this, probably more the adults, but some are involved in younger children as well. So you really need to understand what your involvement is, but even if you're not delivering them, you need to be able to engage with families that are interested in vaccines, be opportunistic in your recommendations for these families as well, because, once again, that's a really important role. So on this NIP, we've got scheduled vaccines, we've got extra vaccines for special risk, preterm, meningococcal, extra varicella, COVID, and more recently those RSV products as well. So this is a guide and should be used in consultation with the immunisation handbook, but once again, it's that lifespan approach that we're moving towards, and in that era of decreasing vaccination rates, as that trusted healthcare provider, which we've heard a lot about today, it's your responsibility to familiarise yourself with this so you can give your best and strongest recommendation moving forward. So I think we've talked a bit about RSV prevention products today and eligibility. So there's lots of guides out there as to who's eligible for what and when, but this is also a moving space and quite confusing. So we've got the older adult recommendations with the 2 vaccines that are recommended there for adults, so the Arexvy and the Abrysvo. There's no brand preference, both can be given at any time of year, but obviously there's seasonality in some states, and for others it's all year round, particularly in those tropical regions. So being familiar with those recommendations is really important, and just once again, when we're talking about changing landscapes, the TGA's recently approved the RSV Arexvy vaccine to people with risk conditions to 50 to 59. So once again, that's something that you need to understand and be up to date with as well. So subscribing to those alerts and newsletters, and I'm sure, in that setting and in GP settings, primary care, wherever it might be, everyone needs to be up to date with what's happening there. And more recently, we've got the National RSV Maternal and Infant Protection Program. So that commenced on the 3rd of February 2025. So while there's 2 parts to this program, the maternal program with the Abrysvo recommended from 28 to 36 weeks. It's actually registered from 24 weeks, but that's really important to understand and to have a really meaningful conversation, particularly if you've got families coming in talking about pregnancy, and just knowing that these vaccines are available to these pregnant people. And as a second option for those that might have some hesitancy, there's obviously the opportunity to counsel, but the second option would be that monoclonal antibody. So it's understanding that as well, even though you won't be able to administer that in your community setting, you need to understand the eligibility criteria for that particular product as well, because it does go hand in hand, and you need to be able to highlight that in the conversations that you're having with these women. And just important to note that there's currently no RSV vaccine available for infants, but it's understanding the difference between these monoclonal antibodies providing that direct protection to infants versus the passive immunity provided by the vaccine through that active immunisation of the pregnant person. So whilst on maternal vaccination, this is just a reminder, I'm sure most people would be familiar now, but if you haven't been pregnant, or you're not in a situation where you're dealing with pregnant people regularly, it's good just to be reminded though of what's available to these individuals. So influenza vaccine is very important. We've talked about the pertussis vaccine and the success of that program as a cornerstone of protection for infants, and that's generally between 20 to 32 weeks, that's the ideal time there. COVID-19, not routinely recommended, but that's a discussion that you can have with your pharmacist or healthcare provider. So this is all about collaboration. I think that's a really important message here. We're all working towards the same goal, but wanting to get there the best way that we can and for the most convenience for individuals as well. And then obviously the RSV program as well. and that protects the babies from birth until 6 months. So it's once again knowing the difference with the products. If they're asking about different things, what's the best time to have it. So you need to be understanding of that as well. And just a reminder here, Abrysvo is the only RSV vaccine registered for women at this point in time. So Arexvy should not be given, so I'll talk to that shortly. And we've alluded to travel as well, so there's an expanded role for some pharmacists to provide some travel vaccine. It may not necessarily be as part of a consult, but certainly they are authorised in some states to administer travel vaccines. So once again, you need to be cognizant of what your legislative requirements are, and it will be in collaboration with other healthcare providers as well in some circumstances. So, in terms of access and some strategies, you may be in a scenario where a family or a individual comes with a prescription from a GP for hepatitis A, for example. So you dispense the vaccine and then realise that perhaps you have an opportunity to deliver that vaccine or administer at the time. So that would be an opportunity. You may or may not feel comfortable doing that. I guess it depends on what the relationship is with the patient and your GP. Some are very close, some are, not so strong a relationship, I guess, but it really depends on what setting. But if you do administer that vaccine, it's obviously convenient for the individual, saves all those cold chain potential issues there, but it's obviously a conversation to, let the GP know that the individual's had it through the pharmacy setting, and of course making sure it goes onto the air as well, so it's recorded, we don't get double ups, which is potentially a problem as well. So travel advice might be sought through a pharmacist, once again presenting an opportunity if within your scope, so you need to understand that. You don't want to be practising outside your boundaries as well, but once again checking vaccination status as part of those discussions. You may identify gaps and opportunities to catch individuals up, and then always referring back to a GP or travel specialist as appropriate, so we don't want to be practising beyond where we should be. Early vaccines for travel, once again, we suit the NIP for our Australian context, but in the current climate with measles outbreaks and all sorts of other things going on, it's really important to have an understanding of that when you're having discussions. If someone's coming in to purchase something else for travel, they might be going away somewhere. Chances are, have you had travel vaccines? Have you chatted with your GP or travel specialist? Is there something that you can offer for them? Early vaccines might be appropriate. You may not be doing them for infants or younger children, but once again, it's nice to be able to let them know that it might be a possibility. And then, of course, MMR as well. That's something that you should be able to advise your clients on as well. So there's lots of vaccines on the schedule. We need to be cognizant of co-administration. Take the opportunity if you can, but once again, if you're comfortable. If you're not comfortable doing more than one injection, don't do it. You're better off doing them separately or sending them somewhere where they are more confident to do that, because we don't want people coming away with a incorrect technique, which is leading to something like shoulder injury related to vaccine administration, which is here. I'm just going to hopefully highlight this visual here, but we have had reports of this situation, not just from pharmacists, but general practice as well. So it's really knowing your anatomical sites. If you're going for co-administration particularly, I'm focusing on the deltoid because that's recommended over 12 months of age, and that's more likely to be the scenario for the individuals coming into the community setting there. But it's basically injecting too high into the shoulder area and causing restricted movement and ongoing pain and suffering for individuals. So this is real, and it's something you really need to be mindful of. So just if you can take away that visual of that inverted triangle and have a feel and make sure you're going into that deltoid and no higher than that. We've talked about the air, so it's mandatory or legislated for vaccination providers to report to air. So you can do this through your Proda account, and I think just highlighting the antenatal indicator that's now available to nominate pregnancy. So that's really important to utilise that aspect as well. Once again, this will help with our understanding of uptake in the pregnant population as well. So really important to be doing that as a routine. Reporting, we've talked about the TGA and reporting, so we receive all the reports, we code them and send them up to the TGA in Victoria. Every jurisdiction has something different. Some go direct to TGA, but it all contributes to data and surveillance post-vaccine licensing. So it's really important to be reporting. We also get vaccine administration error reported to our service, which constitutes a lot of our reports, sadly, but we're able to help provide advice moving forward as part of open disclosure, revaccination and education on strategies to minimise that moving forward. An example of the types of things we might get that are in pharmacy settings but other settings as well, just RSV product confusion. We did have a bit of inadvertent administration of Arexvy in pregnancy when the Arexvy first came out and Abrysvo wasn't on the nip. That's settled down now, fortunately, but it's been replaced by Abrysvo given to infants instead of the monoclonal antibodies. So there's some great guides. The NCS has got a good clinical guidance on how to manage those errors in terms of monitoring, but it doesn't take away from the counselling that's required for individuals involved in these errors, which is a really important component of that and complex. So wrong brands, flu formulations, paediatric versus adult formulations, schedules, timings, all sorts of things, extra doses, which can be averted by looking at air or handheld records, whatever you might have. So expired vaccines is another thing to be mindful of from the pharmacy perspective. We get a lot of expired vaccines as well, which shouldn't be happening either. So it's another opportunity just to check and get your products and storage right. And then we've talked to technique. So strategies to minimise, I think probably in the interest of time I'll keep it moving, but just knowledge of that, understanding those new recommendations, checking available records, doing your screening, identifying pregnancy and gestation. That's really important as well to make sure you're doing it in the right time frame, clear labelling, dispensing, 6 rights, correct technique, all of those things will contribute. So you can see the key messages there, but just take the opportunity to have that conversation. Don't rely on patient recall if they're not sure if they've had something. Promoting benefits with cultural sensitivity as well. Doing those screenings, all the things up there, and just the minimising the error is a really important message from our end. Not suggesting that pharmacists are, a big contributor, but they are a contributor, so it's something that can be avoided as well. And just having those resources available and offering recall for vaccines as well is another opportunity. Just a bit of a plug for the Melbourne Vaccine Education Centre there, which is in liaison with SafeVic. That's got some great learning modules. So if you don't feel skilled, you can upskill yourself by doing some of these modules. There's also open disclosure and how to manage those errors and a great suite of resources as well. So thank you.